name is Akila Peoples. I'm the CEO of Mental Health Research Canada, and I'm very, very pleased to be welcoming you today. I know that we have people joining us from all across the country, from many different provinces. And we just recently launched this Spotlight on Research webinar series because we have a very keen interest in sharing knowledge associated with the work that we do, as well as knowledge that's already been generated by others. So just a couple of housekeeping items. We are going to have our presentation today, and then we will have time for Q&A. So we encourage you to put questions into the chat. My colleague Sarah Murphy will be monitoring that, and we will have some time at the end, and we encourage you to take advantage of this great opportunity to speak with the researchers presenting today and learn more about their work and their future plans. If you're not familiar with Mental Health Research Canada, I very much encourage you to visit our website at mhrc.ca. We are a national charity, and we are very committed to co-funding and supporting research that is poised for impact, and in particular research that is very important to people with lived and living experience. And to execute on our work, we are highly collaborative. In fact, we don't do anything without collaborating with like-minded partners. And I'm very, very pleased to be introducing Purnima Sundar, who is the Executive Director at the Ontario Centre of Excellence for Child and Youth Mental Health. And I know I don't have time to go into much more detail there, but I just want to take this opportunity, Purnima, to say that it is a pleasure and a privilege for Mental Health Research Canada to partner with your organization. I know we have many partnerships, and we are jointly executing on a number of grants, past, current, and present. And your team is wonderful to work with, and it's always a delight. And we truly believe that together we have greater impact when we partner with others, and it's certainly a pleasure to do this work with you. So Purnima will be introducing our presenters today, but a big shout out to you, Purnima, and your team, and thank you for all of your support and your wonderful spirit of collaboration.
Thank you so much, Akila. And I would just say all of that right back at you and your team. You folks are such a pleasure to work with. We've had such a fun time working with you, and obviously we're not stopping, right? We're continuing on and talking about new collaborations as we move forward. So for folks that aren't aware, our organization, the Ontario Centre of Excellence for Child and Youth Mental Health, works to support community-based mental health organizations that support the mental health of our children and youth throughout the province. So we're really, really excited because our partnership with MHRC means that we are able to take all the good stuff that's going on in Ontario, really focus on it, help it to grow, and then build it and scale it beyond our province. And so this presentation that you folks will hear today is really one of the very first collaborations that we had, the fruit of one of our first collaborations. And so we're so thrilled to be hearing today from Jennifer, Erica, Maria, and Tria. And I'm going to introduce Jennifer and Erica and ask that they introduce Tria and Maria. Dr. Jennifer Courtier is an associate professor at McMaster University in psychiatry and behavioral sciences and a child and adolescent psychiatrist. She's been the medical co-director of the McMaster Children's Hospital Pediatric Eating Disorders Program for the past 13 years and is also the co-chair of family-based treatment at the Eating Disorders Association of Canada. And Erica Cruz is the targeted prevention lead at Danielle's Place, part of Reach Out Centre for Kids, which is one of our lead agencies here in Ontario that focuses on early intervention and prevention of eating disorders in children and youth. She's been with ROC for the past 4 years and has developed 4 different psychoeducation eating disorder prevention programs for children and youth aged 8 to 11 years old. She's a member of various eating disorder initiatives across the country and is currently training in emotion-focused family therapy through ROC. So maybe Jennifer, I'll hand it over to you to do the rest of the introductions.
Sure. It's a pleasure to also have Tria Lowens here with us. She is our lead parent facilitator. And so much more than that, I've known Tria for many, many years. She is a mom of a young lady who is now recovered from her eating disorder. And Tria will be talking about the implementation of our study and how it's going. Maria is also with us, Maria Nikula. She is a graduate student who's been helping with the recruitment, and she will help with the analysis on this project as well. So we could probably get started at this point. Maria, are you going to share the slides?
Yes, I am. I'm just trying to right now. Wonderful. Are you able to see my screen?
Super. Yeah, that looks great. And I also want to acknowledge the funding agencies. Thank you all so much for supporting this project and all the collaborators, including the National Initiative for Eating Disorders as well, who are part of our study. So you can flip to the first one, Maria, I think. Hand it over to Erica.
Excellent. Yeah, so thank you so much for having us here today. I'm so excited to share a little bit of all of the amazing work that's been done with this group in such a short time. So to start, I'm just going to give a little bit of background on the significance of having a parent support model in the context of eating disorders. So eating disorders are known to not only influence the individual living with a disorder, but also their close family and friends. So this is especially true for pediatric patients, given that the treatment most supported by the evidence involves high family involvement. And this modality is called family-based treatment, or FBT. Although highly effective, the treatment places a high burden on parents, tasking them with the responsibility of refeeding the child while also interrupting the eating disorder behaviors, meaning that parents will often have to step away from their jobs, other family members, so like siblings, social support. So it can create a lot of isolation for the parents or carers in the child's life. Several years ago, parents from our program identified a significant gap in McMaster treatment services, hearing that they would value the support of other parents. One parent who is here today, Tria, whose daughter had been treated at McMaster, took on the leadership of a parent-led support group. And over the course of the last 5 years, the group has flourished with very little oversight from professionals. Currently, this group is run out of Danielle's Place, which is under my portfolio. And it operates under ROC, which is the Children and Youth Mental Health Agency in Halton. Danielle's Place is a specialized program offered by ROC. It's been under ROC's portfolio since 2015. And it provides targeted prevention and early intervention services for children and youth between the ages of 8 to 18 who are at risk of developing an eating disorder or maybe expressing concerns around low self-esteem, body image, or have a preoccupation with food and weight. And as a program, Danielle's Place is committed to offering creative, safe, and ongoing programs and services for clients that aim to build a sense of resiliency, confidence, and connection. Perfect. Flip to the next slide here. So through the support groups, such as the one developed by Tria at Danielle's Place, parents can be supported by other parents who know the system and can advise them on how to proceed and empower them to help their children. The system can often be one that's complicated, challenging, scary, hard to navigate. So that extra support from folks who already know that route is super helpful. There are reports of clinician facilitated parent groups and internet chat support groups, also facilitated by clinicians, but no current reports exist of parent-led support groups for parents of children with eating disorders. That being said, it's extremely valuable to hear from someone with lived experience rather than hearing it from the professionals. Individuals with eating disorders are often considered too medically ill to access mental health services, or their circumstances are too complex to be eligible for a strict eating disorders program. In this population, comorbid mental health conditions are the norm rather than the exception, making that kind of one-size-fits-all approach rather ineffective. So some of the benefits of a parent-led support group are well described in the literature, specifically when we look at children with disabilities. They can aid in a sense of belonging, help parents feel like they have a better handle on the world, and can even develop like a sense of advocacy for themselves. However, there's no such reports in the field of eating disorders. This is despite the fact that it is well known that parental self-efficacy has been associated with better outcomes for children with eating disorders. And in some of the recent Canadian practice guidelines developed by some of the lovely members on our team here today, parent-led groups were highlighted as an important aspect of care that is sorely needed. I have a little bit of a background on that.
Okay, I think it's over to me now. So about last spring, the granting opportunity came up to study virtual care and family interventions and such. So I said to Tria, wouldn't it be great if we could study your parent group that you've been running for several years and actually hopefully demonstrate that this really is effective? Not that I'm biased, but we wanted to gather some evidence base because we knew there was no evidence base out there. So we decided to gather with folks from the ROC and collaborate and put together a proposal. And we wanted to look at primarily the feasibility of this intervention. Is it acceptable to parents? What are our recruitment and retention rates? What's the cost of such an intervention? And we wanted to look at how parents viewed it as well, looking at their outcomes. Not so much focused on the young people, but the parents themselves. How did they benefit from a parent-led parent support group? And we wanted to look at quantitative and qualitative methods. This is our timeline for our methods. So we have a quantitative package of measures, including the Eating Disorders Symptom Impact Scale, which is meant to measure caregiver burden, and also the Care Needs Assessment Measure, which is focused on caregiver needs, as well as the Patient and Care Collaboration Scale, looking at parental self-efficacy and collaboration. So this package of measures is given at baseline, like at the time of consent, and then parents go into the group, which is held twice a month. And then the measures are given again at the 3-month point, and then at the 6-month point. And at the 6-month point, we also want to do a qualitative interview with all the parents that finished the group, or even those that may have left early. And we really want to get their perceptions of the group. How did it go? What was the best part about it? What were some of the challenges they might identify? Like, for example, this might come up when Maria or Tria talk, but some may find it hard to find a private space in their home. So we really wanted to get at their perceptions with a qualitative interview. And this kind of demonstrates where we are in the timeline of the study. So we've been recruiting for about 5 months. We're right at the end of the recruitment phase. We were a little delayed with ethics. I think because of the pandemic, we had a little delay with getting ethical approval, but we've been making up for it in our recruitment because it occurred very quickly at the beginning. And then we focused on the north, which I think Maria will talk about as well. It was a little slower recruitment in the north, but now we're finishing up our recruitment with some southern parents. So that the support group has been running consistently since the beginning of recruitment. And at the end, you'll see the analysis phase once the support group ends. And you'll also see there a couple examples of the timeline of a couple of parents. So one might have started right away at the beginning of recruitment, and they might be almost done. And then we're just recruiting our very last few parents right now. They'll be done in December, and then we'll complete all our analyses. So I'll hand it over to Maria at this point.
Wonderful. The only thing I failed to mention about the support group in the last slide was it's ongoing all the time. I think we were just highlighting when the support groups that would be involved in the study would be studied essentially. As for recruitment, we set a desired sample size of 40 parents. Originally, we wanted to capture the experiences of 20 parents from Northern Ontario and 20 from Southern Ontario, but I'll talk in a little bit about some of the difficulties with gathering the 20 allotted for Northern Ontario. And some of the eligibility criteria for inviting parents into our groups are them being a parent of a child with an eating disorder, currently around 20 years of age or younger and diagnosed as a child, so under the age of 17. And this was mainly so that the parents involved in the groups could relate to one another, also on the experience of having gone through the pediatric system or trying to get into the pediatric system. And we've collaborated with a number of different organizations to spread the word about our study. So of course at McMaster Children's Hospital, through Danielle's Place to the parents who would be interested in the group, as well as through Occuped, directed by Gail McVeigh, and some direct clinics, including CHIO in Ottawa, through the clinic and the doctors and psychologists at the clinic. Need, of course, is very involved with our project. So they've been posting our flyer on their website and a couple times on Instagram. And last but not least, of course, direct contact with clinics and programs, specifically in Northern Ontario, especially when we were trying to recruit for the 20 parents up there. So this is just a chart of where we're at in terms of recruitment. So far, we have recruited 35 parents that are enrolled and participating. And there have been a few more Northern Ontario parents in the last couple of weeks, actually. So we've been able to go from 7 a couple of weeks ago to 13, which is great. We're getting that perspective in our study. And the handful of participants, you'll see the 3 at the bottom there, who requested to leave the group, but they are included in our overall sample because we have collected measures from them. They left for a couple of reasons, one of which Jennifer already mentioned, being no privacy from their child with the eating disorder to be able to participate in the group. Another person, it was too emotional for them and they found it difficult to relate to the other parents, and they didn't find the group itself problematic. It was just not the best fit for her. And then the last parent, there wasn't enough time for other reasons, very busy personal life to be able to commit to basically 2 hours of a support group every 2 weeks. So now I'll pass it on to Tria about the support groups.
So hi, everyone. The support groups we have 4 of them now. There's the original one that I had started, and we've had 3 offshoots from that. So we have 4 that are being encompassed in this study. They are led by ROC approved parent facilitators. So all of the facilitators have had their records checks done. They've been interviewed. They've been vetted through ROC, which I'm very grateful for. The group aims to address obstacles and issues that parents experience. The common thread that we hear during our groups is, I don't know how to cope with this. Unless you've walked through this, you don't understand it. So we've got everybody there that work with each other. We as facilitators work with how to deal with resistance, coping skills. We try our best to instill hope and to really focus on allowing them to take some self-care. So even if it's that 2 hours every 2 weeks, that they have time where they can focus on what they need for themselves, that's something that's really key for us. Of the 4 groups, the typical setup is a brief greeting, then we read a group conduct, just to basically say this is this is our group, what's said in group stays in group. If you've got concerns that are outside of the eating disorder and you need somebody to talk to, please contact one of the facilitators and we can talk afterwards. And please use eye language and be very positive in how you relate to other people's stories. We ask for a quick check-in with getting a word of the day so that we get a sense of what the flavor is around the room and who might need more help than others. Then we have some sort of education piece where we're discussing communication skills, which was one of the most recent ones that I had done, looking at DBT skills. And parents really appreciate this, and we can see it being incorporated in throughout our discussions. We open up the last hour and a bit for questions and answers with all participants. So this allows for the parents to get to know each other and to break away some of that isolation. At the end of the evening, we do a recap of all the resources that have been mentioned, and those are also sent out in a follow-up email within a couple of days. Early reflections, we've got very strong facilitators that have taken up these roles. All of them have got very busy lives, but they feel very strongly about this. We see very brave parents that are willing to take a chance and to do this virtually. Every week that we see them, you can tell that they've worked it hard to be able to make that time available. There's one group in particular where the first night they were crying, and I was able to sit in on the group a couple of weeks later, and there was this incredible change amongst the group, that it was cohesive and they were helping each other and calling each other by name and saying, you know, I tried this, did that, you know, I mentioned this last week, you know, did you try that? Yes, I did. And just this give and take, which was just phenomenal. There's learning opportunities, as I mentioned, with our curriculum, our loose-based curriculum that we provide. And as I mentioned, the peer support between peers is absolutely fascinating to see. Our facilitators are on their own personal journeys because they're now moving beyond the eating disorders. Every parent has had a child within the system. And so now they're moving beyond, so that because their children are now in recovery. So they're growing and changing as individuals as too. And I was not expecting to see that, but I'm so glad to see it. And one thing we see every night from every group is thank you. Thank you for being there. Thank you for listening to us. Thank you to the whole group as a whole, because everybody's there to support each other. I know these are only anecdotal, but I also saw that whenever I led the group by myself, and it was an in-person group. So I'm really thrilled with what we're seeing, and I'm looking forward to what the data has to show. Thank you.
So I think that's the end of our formal presentation. We went quickly, more quickly than I thought, but I had been thinking to Tria about just all the positive comments and the strength of the facilitators as well, and how amazing it is that people feel so passionately about this. And as a service provider working in a hospital, sometimes in this pandemic, we've had people going back to their home areas with no service. Like they're waiting on a wait list for outpatient treatment. And they've been so grateful to have the parent support group as an option for them. So I want to thank you too for doing what you do, and to all the parents.
Thank you for that. It's been so good to have Mac be there and for Rock to be there, and especially for this grant. 6 years ago, whenever I started this process, I never expected to be where we are today. And I'm so grateful that we're able to make a difference in people's lives. And that's all that I've ever wanted to have happen.
Wonderful. Well, what an impressive presentation. Thank you all for making the time available today. And it's so exciting that really you're charting new ground here. It sounds like this is the first research of its kind. So we're very, very interested in the results and looking forward to following your efforts. I had a couple of quick questions to kick things off. I was interested in the word of the day concept. I'm wondering if you could explain that a little further.
Okay. What it is we go around the room after we do our group rules, and we just ask for a word of the day. And we can get everything from hopeful to I'm tired to I'm fed up to excited. And whenever we go around the room, we try very hard to mix the positives with the ones that are struggling, so that we don't have all the positives going first and then you have the negative ones behind. You do a positive one, then you do a negative one. And it allows for the room to be more balanced. And people seem to really like this concept. We noticed that people are preparing their word even before we ask for it. So they'll say, at the beginning of the week, looking forward to the group, I was starting to think about my word of the day. It helps frame for them positiveness going forward, to look at the yays for the week per se. It really is a helpful tool within the group.
Wonderful. Thank you for further clarifying that. Clearly, you're doing very, very important work. I have a couple of questions already, and I encourage others to add questions into the chat. What training have you found helpful in your role as a family peer supporter, or what skills, knowledge do you think is important for family peer supporters to have? I think that's for Technia. I think I'm going to
Tria.
Right.
Go with Tria. I actually started off this just being a peer, somebody that is interested in helping. The big step that I did a couple of years ago was to be trained as a peer support worker and to focus on families. I don't think it's important to have that training eventually, but the biggest thing is knowing that you're going from peer to peer. So as long as you've got somebody that is knowledgeable in the eating disorder in which they walked with their child with, have a passion for helping each other, and also being open to listening to other people's ideas and being organized. Those are the key things that I would focus on.
If I can jump in really quickly, just to kind of add to that a little bit. Rock has also been able to provide the facilitators. So some of the other parent facilitators that Tria mentioned are taking on some of their own groups with Center of Excellence to provide peer support training for each individual before getting into the group. We also provide various, it's called WRAP, and I think it's Wellness Recovery Action Planning for folks to access as well. So there's lots of different peer support opportunities within the agency. Like Rock as an agency, we're huge advocates for that work. So we definitely have the options there, and we're putting good process in place to make sure that our future facilitators are trained up and they have the skills to facilitate for sure.
Thank you for that, Eric. I see in the chat, Peer Support Canada offers certification for family peer supporters too. So just acknowledging that for everyone. Another question, do you have follow-up sessions for those who may have left the program? I'm not sure who wants to answer that.
So in terms of the research, we do try to follow up and see what happened, and do the qualitative interviews so that we have a really good sense of what were some of the barriers that got in the way of their participation in the group. And we often provide a resource list for any parent actually entering the group or leaving the group so that they know about other resources. But in terms of follow-up from your side, Tria, What would you guys typically do?
If I haven't had a situation with anybody from the study. If there's somebody that has been involved with my group outside of the study, I may reach out to them periodically to see how they're doing. But generally, once they've stepped away from the group, it's an indication to me that they no longer need us. I've had texts from people a year later saying, hey, I need some help, and they'll come back. So that relationship is there, but it's very loose.
Thank you. A question from me, actually. What do you hope to do with the findings of this important work?
Mm-hmm. Well, one future goal is to disseminate this further. So with our preliminary data and our feasibility data to say, hey, like this group was highly sought after, our recruitment rates were very high in our densely populated areas, and there's a need for it. And with that information, we hope to apply for a larger grant so that we could expand this across the country. Hopefully, that would be the dream.
Well, and it's wonderful that part of this work involves a partnership. And I know Wendy Preskow is on the line with the National Institute of Eating Disorders. It's wonderful to have that connection so that we can support knowledge sharing as we move forward. Another question, is there a minimum or maximum number of participants that's ideal for each session?
What I have participants that are part of the study, and then I have a core group of people that have followed me forward. The most that I would want to see anybody carrying would be about 10, having 10 individuals. Some nights I range up to 15. At a minimum, as long as you've got one person, that they can, sometimes the nights whenever there is only one person, that person needs that one-to-one the most. That has happened to me several times over the years. And so as long as there's one person that shows up, it's well worth the time spent.
Wonderful. A few questions coming in here. I'll just read this one. Excuse me. Thank you for such a fantastic presentation. Do you think that there could be utility for extending this type of support group to parents of young adults, given that many young adults live at home longer in this generation? Perhaps you may need to wait for your initial results before making such inferences, but I would love to hear your preliminary thoughts.
That's a great question, because we had discussed this as a team. And I'd love to hear Tria's thoughts too about working with the transition age youth, like up to 25 we thought about, but it's a different feel to that group, to that population. Maybe Tria, you can share your thoughts.
Okay, yes, the biggest challenge with that is to have the peers to be able to facilitate that discussion. I'm sure that we can find those people out there that would be willing to walk alongside our parents, the parents. I don't have experience with that, so therefore it's an awkward, I can't be a peer-to-peer in that situation. We do have some, we've got 3 parents that are in that situation where their children are transitioning into adult care, which will enable them to meet that criteria as well. We do have an agency in Hamilton that is working with that population as well. So there is a little bit of stuff out there, but yes, definitely that's possible to make that happen. It's just finding the right facilitators.
Wonderful, thank you. Another one, thank you for your presentation and amazing work. I look forward to seeing the results from the study. Do you find that it is usually the mother that attends the group? Can both or multiple parents attend if interested?
Yes, yes, yes. Yes, it's primarily the moms, but we do have a strong representation of dads through the study. I do kind of gush whenever I see a father there, because they are critical in that recovery phase. The fathers that I've seen so far in the different groups outside of mine, they are sticking with the course and are actively involved, and I think that's fantastic. There has been a question from a couple of the facilitators of whether or not we should be looking at a father-led peer support group. So that's something for the future, but there's definitely a need for it to be able to reach them on their level. Moms like to talk together, and I find the fathers tend to sit back a bit, but they're the ones with the really critical insight into the situation at home.
Thank you. Do you think there is a need for skills-based training and or support for families?
Oh, yes. Yes, that's part of the reason why we have the support groups. It's and a new group that I sat in on last night, the conversation was, I feel like a mom bringing home a newborn. I don't know what to do. And that was somebody that had been in hospital for a couple of weeks. They had been refed and then were they were discharged. And so there is that need for specific training. So the support group is helping with that, but it's not as strong as it could be.
One of the cool things that ROC also offers is EFFT. So we're in the process of offering ongoing EFFT. And we have referred a few families to those like skill-based training opportunities. So the EFFT that's provided out of ROC is training up the family to provide EFFT in the home. And we know that has good outcomes for children affected by eating disorders as well. So that's something that we're able to offer as an aside. And ROC is not operating with a catchment area right now because everything's virtual. So we've been able to extend our reach a little bit there as well. So just other skill-based areas within the agency is exciting for sure.
Wonderful. A couple other questions. How do you find and or recruit facilitators?
Our facilitators for this study, we initially wanted to be recruiting and are actively looking at our participants that have come in under the study. The facilitators that we're working with now are people that most of them have come through the support group that I had been running for years, and they're now in a position where they can take on a greater role. And the other facilitator who is in the Ottawa area, she ran a support group in the Ottawa area in an in-person venue. We're actively looking for new facilitators so that if we are able to take this further, then we would be able to get these other people up and running.
Yes,
Wonderful.
I put in a plug there that if anyone's listening and watching this and they're in different provinces, and we would like to develop this grant and have a hub in each province of parent facilitators. So if you know anyone, please contact me.
Well, maybe somebody could put an email address in the chat box in case somebody is interested. Also, timely question, is the group virtual? And if so, could access be extended beyond Ontario? You just mentioned an interest in that. So we'll see what lies ahead with that. Clearly you have an interest in that, which would be tremendous for knowledge sharing. Wendy's asked, what about a group for siblings?
That's a great question. I think also not studied before, and siblings really go under the radar. I think we don't pay enough attention to them, and a sibling support group could be awesome.
Yes.
How much time is devoted to the curriculum part of the group meetings?
It can be as short as 10 minutes and it can go as much as an hour. Depends on what, excuse me, it depends on what the topic is and how much insight people are asking for. So normally we don't want it more than an hour because we want it to be able to provide the support piece, but anywhere between 10 minutes to an hour.
We have quite a few more questions. We still have a few minutes left. I'm going to try and get through these. Have you been able to find evidence on which parent has a larger role in helping their children?
Well, we probably shouldn't say. I don't think we have evidence. I don't know, actually, but I think that we do have more moms attending the group, as Tria said. And I mean, anecdotally, moms seem to be more involved.
And what has been the greatest challenge in conducting this study?
I would say the northern recruitment has been the largest challenge, and we have made significant efforts to reach programs up there and have them distribute the flyer to their wait lists. But it was a challenge, and we're trying to figure out why. Don't know yet.
A question, I see that FEAST, F-E-A-S-T, is offering training for parent peer supporters. Are you familiar with the content of their training?
I am not.
And so I have maybe a final question. You know, I think one of the really important elements of the work that our organization and our partners, the Center of Excellence and other partners, is that the authentic engagement of people with lived experience and the work that we support is central and critical to whether or not we would be endorsing or supporting some research. And you folks have done such a great job illustrating that this is truly a team effort. And for those listening that don't know, any of the research applications that come in must have that authentic engagement. They can't just have a letter of endorsement from or run an evaluation report by. They must be working hand in hand with people with lived experience on their working team. And you folks have just demonstrated how important that is and what a key element that is, and clearly why this project was one that was selected. I'm wondering if any of you want to comment on that in terms of rolling up your sleeves and working side by side with each other in that important way.
I would say it's been awesome. And Tria helped me with the measures for the study because I value so much her insight because she's been through this and I haven't. So to have her, such an amazing person and a valuable resource to this project, it's just such an opportunity for me.
I think.
Well, I'm going to give the last word in a moment back to Purnima, but I would like to thank my colleague, Sarah Murphy, who does such a tremendous job managing everything associated with our research work and our partnerships at Mental Health Research Canada. And I always hear great feedback on how wonderful you are to work with. So thank you, Sarah. It's a pleasure for us to work together with you. Congratulations to this research team. We would love to have you back down the road when you have more findings to report. I'm sure there would be a lot of interest in this. Would love to hear about, you know, possible expansion to other parts of the country, and happy to try and support that in ways that we can by making connections. And I would just like to put a shout out to we have another session in a month, and we hope that you folks will join us. Sarah, I don't know if you have that slide, if maybe we could end on that. While I turn back over to Purnima to say some last words. And again, Purnima, I want to thank you and your team for your partnership with us. As I mentioned, it's always a pleasure.
Thanks so much, Akila. And thanks to this amazing research team. This is such an incredibly valuable and interesting project to learn about. And we're just so happy, I can say from our perspective at the center, but I know that our partners at MHRC are also so pleased to be supporting this really innovative and exciting work. Especially right now, I think we're all aware that there is, the pandemic has produced lots and lots of negative mental health impacts on our children and youth, and the families that support support them. And so programs like yours or projects like yours, you know, these interventions need to be learned about and scaled up. And so we're really pleased to be supporting that to happen. So thanks to you all, and thanks to you, Sarah and Akila, for inviting me to sort of host this with you. This webinar series is really exciting to me. I spent many, many years as a director of knowledge mobilization. And so getting research findings into the hands of the people that are going to use it is a real passion of mine. So I see this type of knowledge mobilization activity as a really, really integral part of that. So thank you so much for including me, and I wish you all the best. Have a great rest of your week.
And if anybody has any final questions, I saw a couple come in there at the end, please feel free to email my colleague Sarah. And if the team doesn't mind, we will get questions to Jennifer and team, because the interest here is in sharing knowledge, as Purnima has mentioned. So I'm sure we would help facilitate those connections and get some other questions answered. And there's our next webinar. It's from New Brunswick. It's a very interesting project, Dr. Aaron Fredericks, and the topic is a virtual support program led for and by senior members of the LGBTQ+ community, and it focuses on resiliency and that intergenerational connection. So very, very interesting topic, and I hope that many of you will not only join that one, but also share that the broadcast email about it, and maybe look on social media for it and share it with others. And we look forward to seeing you again in a month. I hope everyone stays safe, and that we are inching towards back to some kind of sense of normal, whatever that maybe looks like in our country over the next 6 months or a year. But do stay safe, and thank you for joining us, and we look forward to seeing you again.
Thank you.
Thank you
Bye.
for having us.